most providers now treat IBS as through the lens of like a biopsychosocial model of irritable bowel syndrome. And so first line, it's mainly, diagnosis. We're moving towards like a diagnosis of inclusion. So historically, it's been a diagnosis of exclusion. Let's, exclude celiac, let's exclude IBD, and then eventually IBS. But now moving towards using the Rome criteria and some of these other more positive diagnoses to get to that answer without having to necessarily do all of that. And then at that point, there is maybe like minor lifestyle modification. So that might be fiber or supplements, peppermint oil. And then after that, most commonly it's treated through a lens of like, medical management. So that might be like antidiarrheals, might be Linzess for constipation. So there's this medication management. The drugs are like moderately effective. There's neuromodulators and things like that can be effective as well, but it's not a super effective area, but it can help, especially on these sort of symptom-specific categories. And then there's like diet modification. And by far the first line diet modification is the low FODMAP diet. And so there's a certain type of carbohydrate, so FODMAPs, and these FODMAPs ferment in your gut. And that fermentation brings in water, it causes gas, and that can then lead to this, at least hypothesized to lead to like activating the visceral hypersensitivity, so the overly sensitive nerves to the gut. And so those are the two other combinations. And then the third is behavioral. So that's now called brain gut behavioral therapy is the latest terminology for it. And that consists of either CBT or gut-directed hypnotherapy as the two main evidence-based approaches for delivering that.